Welcome to Focus Radio and Television, brought to you by Red Apples Media. I'm your host, Anthony Rayo, and now on stands is our Madness in March issue. You can see what your neighbors and a few community leaders are so angry about and find out what's being done to calm us all down. Plus, if you go to FocusLakeCounty.com, you can check out this month's Focus TV segment that includes everything from a maddening video to Leesburg Mardi Gras Pet Parade and Lake County's Tourism Forum. So, plus you're going to be able to see this radio program and other Focus TV segments on LSTV, Comcast Channel 13, Bright House 498, and Florida Cable 4, or online at LakeSumterTV.com and FocusLakeCounty.com. You can listen to this radio program, Focus Radio, on the first and third Thursdays of each month here on WLBE at 1:30 in the afternoon. And today we are going to be talking to Face2Face Aesthetics and Wellness. We're going to be first talking to Dr. Dino Madonna, and then later we're going to welcome Tammie Callahan and Chelsey Hartenstein to our program. But right now we'd like to welcome Dr. Madonna, the board-certified facial plastic surgeon and medical director of Face2Face Aesthetics and Wellness with the offices in the Villages in Leesburg. Thanks for being with us, Dr. Madonna. We wanted to take a minute to congratulate you. I understand you were just awarded, really, kind of a couple of weeks ago. You were featured in the New York Times as the Castle Connolly, one of the top doctors. What does that mean to you, and what is that award about?
Oh, it's a great prestige. To me, it just shows recognition amongst my peers. When I first received a notification, I actually researched as to how that came about, and it's basically a peer reviewed amongst surveys amongst other physicians, and I found it a great honor that I was thought of in such a manner.
Yeah, very prestigious, seeing that it was the peers who felt that you were worthy of that distinction, and they saw the work and the hard work that you've been doing, knowing especially the strict criteria for such a nomination. Now, we want to start, Dr. Madonna, by asking you a little bit about your experience in the field, your background in the field. Can you tell me what is your experience, and what does that mean to what you're able to bring to patients now?
As far as my training, initially it was in ear, nose, and throat, and then as a subspecialty I went on to do extra training in a fellowship of facial plastics, and it's recognized by the American Board of Medical Specialties, and it's the American Board of Facial Plastic and Reconstructive Surgery. So, you know, it's like taking a lot of knowledge in the anatomical area and then applying it more for cosmetic and reconstructive purposes.
Yeah. So now your education, your training, where were you educated at?
Which part?
So it's an extensive list, isn't it?
Yeah. As far as medical school, I went to Rutgers Robert Wood Johnson Medical School in New Jersey. I did my ENT residency in Philadelphia at the University of Temple. And then I went on and did the fellowship by the American Academy of Facial Plastics.
Wow, so if we go to you, you really know what you're doing thanks to that training.
Man, long time.
Yeah, it's a good thing.
Yeah.
It's a good thing. We have to trust our doctors. So tell us about your passions in this field.
Well, I mean, I guess I've always had a flair for, I like putting things back together. I like seeing, for instance, from the reconstructive standpoint, I like seeing something that's, you know, either been violated by skin cancers or some trauma, and I like to see how I can put that together back in an aesthetic fashion. And also, you know, it's key to, while you're putting stuff back together in a form, to respect the functionality. So, for instance, in the nose, when you don't just want to rebuild the tissue, but then they can't breathe out of their nose. So you have to kind of combine the two, and it takes a lot of three-dimensional artistry to kind of figure it out and put the pieces. I enjoy puzzles too as a kid, so and the Rector set was always my favorite. So the other thing from an aesthetic standpoint, I like stuff with shape and symmetry, and I found it's a great way to incorporate it into what I do on a medical aspect. So right. It's a great field.
Very cool. Now you really treat each person almost as a work of art, is what I've been told. And everyone has a personalized experience. Why do you think that's important, and why do you do that?
When I have the patient interview, and hence that's how the name of Face2Face evolved, because it's a face-to-face interaction. To me, it's about seeing what a person's expectations are, what they kind of see as their problem areas or issues they want to address. And then as physician or surgeon, I'm trying to put those pieces together and see what can I realistically provide in a safe manner. And also, obviously, there's always an economics part to it, which sometimes kind of, from the cosmetic standpoint, kind of limit as to what's available to the patient. But that doesn't mean that you can't improve upon someone's features. It means you can't have them feel better about themselves and do things. And there's a whole gamut. I mean, there's the lesser invasive things to the invasive surgical aspect. And that was the beauty of putting Face2Face together. I mean, I've been in the area for 15 plus years. The service or the actual ability to perform the surgery was always there. So if you came in to me and said, hey, I want my nose done, you know, whether it's cosmetic, and quite often it's a combination of the two. It's functional as well as a cosmetic standpoint. So that part was always there, but having the other pieces to kind of go the whole scenario, from having you know, the esthetician to kind of, from a skincare standpoint, to kind of do the pre-treatment and the post-treatment.
Right.
For the maintenance standpoint, for that complete sense of well-being and wellness, I needed to form a team, and that's something I wanted to do, and I took my time doing over the years.
Yeah, and many people know you from your work at Lake Ear Nose and Throat. So what really gave you that inspiration, and what made it a passion of yours to start Face2Face?
I think it was always there. I just had to find the right time, the right people, the right team, the right scenario. The passion's always been there, the ideas have always been there, and I mean, I'm always trying to incorporate new things into Face2Face. So a lot of it is just finding the right ingredients.
Yeah, neat. Now let's talk about some of the specialties that you actually can tackle. You've got neck, facelifts, brow lifts, and Botox and other injectables, laser treatments, facial rejuvenation. I mean, the list just goes on. Talk about a few of those and what areas you can concentrate on to make the experience for the person that much better and the effects long-term down the road.
I'm a facial plastic surgeon, so I don't do tummy tucks or breast augmentations. It's literally head and neck area. So with regards to face and neck lifting, you know, quite often what you're doing is you're rejuvenating. You're taking away what time has brought on, you know, the sagging, the loss of elasticity, what the tolls that gravity has played, and you're lifting up the tissues and to kind of reforming over top the underlying structures of the bony structure underneath. So, you know, you're addressing jowls, you're addressing a neck waddle, the excess tissue under a neck, you're kind of improving upon the jawline. So all those things are surgical techniques on a face and neck lift. With regards to rhinoplasty or otoplasty, that's a nose job or reshaping the ears, you know, you're actually changing the form in that, and that sometimes is really life impactful to a patient. It's something that, you know, maybe they've always been self-conscious of the bump, you know, their hook on their nose or the bump on their nose, or that it's crooked. To be able to really kind of address that and change how someone looks. Same thing with otoplasty or ears. A lot of times if their ears are sticking out, right, and they've always been conscious of it. You get some ladies who just say, look, I could never wear my hair up before. I always, you know, felt like someone was looking at me. And maybe they've never had the time or the money to address it, and here they are as adults.
What a difference it makes for them.
Yeah, and you can just see how when they come back in, the self-confidence. I mean, you see, you know, all of a sudden their hairstyle is different. They're, you know, they're really putting makeup on. They're dressed to a T.
It makes me think, is there a particular experience maybe with a client that sticks out to you, somebody that you helped in like a unique way like that?
Quite often you'll see that tremendously in some of the reconstructive stuff. I mean, you have someone who after a skin cancer is missing, you know, a third of their nose, and you're rebuilding it with their own tissue, and all of a sudden they have this large, you know, defect, and after a procedure, and I mean, it takes time. I mean, sometimes there's multiple steps to it. They, you know, they come in, and when the unveiling's done, they're like, you can just see them, you know, tear up and say, hey, I have a nose again. from an aesthetic standpoint, I mean, you see the difference it makes in people's lives. And again, you watch the outward sign, like on a lower facelift. It's just that air of confidence that comes in afterwards. I mean, someone who, you know, look like Father Time's taken a toll, and you've just turned back the hands of the clock.
Changed their life.
And yeah.
That's incredible. Maybe you can expound on that. What are some of the benefits of coming to you and having either a facelift or any of these other services that you offer done?
Well, again, that's where the face-to-face interaction comes in, and that's what we try to find out is you know, what's the motivation? Is it something that you just always want it done? Is it a personal trait or characteristic that you just always found to be in the back of your mind bothering you? And or is it something that, for instance, if you just have a lot of lines that have occurred with sun exposure over time and you come in for laser resurfacing, there's everything that from pigment changes, and you know, there's a whole gamut of lasers. I mean, we can go on and on as far as all the different types, but you have skin resurfacing, you have pigmentation changes, you have rosacea and just red veins, and a lot of that's just with, you know, hormonal changes, sun exposure, and you use those lasers in a non-invasive way to kind of help rejuvenate someone, and again, you just see the impact that it has, and they just look nicer and they feel good about themselves.
That's great. Is that why you continue to practice? What really keeps you going in this field?
Oh, it's the interactions. Yeah, that's fun. I mean, the stories that you get, finding out what makes people tick, watching them kind of go through the process and just have a different view of life, and that it just seems a little happier.
I want to make sure that we find more about your services at face2facefl.com, or we have the toll-free number of 855-MY1FACE. Thank you, Dr. Madonna, for joining us, and we're going to be back in a moment with Tammie and Chelsey, and we're going to talk about their services and the practices there at Face2Face. You're listening to Focus Lake County Radio. We'll be right back.
Thank you.
Welcome back to Focus Radio and Television. You're watching us hopefully on Comcast 13, Bright House 498, and Florida Cable 4, or listening to us here on 790 WLBE. We just finished talking with Dr. Madonna of Face2Face, and now we're going to speak with a couple of his colleagues. First, we have Tammie Callahan, who's a licensed esthetician and medical aesthetics coordinator, and then we also have Chelsey Hartenstein, who's an LMT, licensed massage therapist. Welcome to Focus Radio, ladies.
Thank you very much for having us.
So glad we're here. So we're going to start by speaking about your training and experience. Maybe we'll concentrate on you first, Tammie. I understand that you were trained in both Tennessee and North Carolina and Florida. So tell us a little bit about that.
Yes, I received my license in Tennessee and then continued on. So I'm licensed in Tennessee, North Carolina, and now Florida. At one time I was also working in Texas. One thing that I'm just very thankful for, that I have 20+ years experience working in basically all medical field, working in dermatology, plastic surgery, and laser centers. So again, I feel very fortunate and blessed to have had the opportunity to work with some fantastic doctors, including, in fact, Dr. Madonna, who was just awarded one of America's top doctors in the nation.
Yeah. That's great. We had the Castle Connolly, and that appeared in the New York Times just a couple of weeks ago.
Very
Something
proud
else. Yeah, we should be proud of him for that. Now, you were also awarded and honored one of the top estheticians in the nation in 2013. Let's talk a little bit about that.
Yes, I was actually surprised to learn that I had actually made the list, because I didn't know anything like that was actually happening. It turns out it was through Aesthetics Everything, which is a networking system for physicians, plastic surgeons, estheticians. And they actually would call me and ask questions. For instance, if it was pigmentation, can you explain to me what you're doing, the types of treatment that you're doing to get the results that you're receiving? So that's how it all turned out, and For instance, I know that Dr. Madonna have actually teamed up. He's the physician. He does the pigmentation removal. I then step up to the plate and would do a chemical peel, which would actually help slough off more of that pigmentation at a much faster rate of speed.
Yeah, some of the other things, the services that you have the silk peels, the chemical peels, the Rejuva-Pen. How does that help in what Dr. Madonna does, and how does that go hand in hand?
All of those are very, very important. In fact, silk peel happens to be the most requested treatment that we have. Rejuva-Pen is also an excellent treatment, and then we do offer several other chemical peels, but the silk peel is probably the most requested. And what we find out, people will actually call in, coming in and thinking that they're going to do a facial. After we sit down and do that face-to-face initial consultation, we find out it wasn't really a facial that they're looking for after all. They're wanting a deep cleaning, they want evacuations of blackheads, whiteheads, but at the same time they need the proper serums, hydration. It might be for acne patient, rosacea patient, or someone that's just severely dry. We use the purest forms of hydration to put back and replenish into the skin after that treatment.
What's the difference? Tell me, there's an esthetician and an esthetician, one with an A, one with an E. What is the difference between those?
Well, they're both licensed. They are both skincare specialists. It really just depends on what field that they're going to go into after they graduate. Just so happened that I decided I wanted to stay more into the medical field. And when you go into the medical field, it's a daily education and training, working with either chemo patients. You're under direct supervision of a physician or physicians at all times. And you're learning and you're training about the skin. So the initial comes with an A as an esthetician. The E, on the other hand, an esthetician, actually is for one of those that work in a spa, salon, or fitness center.
Okay.
That's the difference.
So that's the
between the
difference.
two.
So more medical field
Correct.
versus the spa or
Right,
that kind of treatment.
exactly.
Now, where again can we find out more about you and the services, the website that we would go to find out all the different lists of services that you
Yes,
offer?
absolutely. Would love to share that with you. It's face2facefl.com or 1-855-MY-ONE-FACE. Also, you can look us up on Facebook. We now have started an educational resource on Facebook.
Very neat. Now, what do you enjoy about working with Dr. Madonna as the last question before we turn to Chelsey?
We're just a great team. With his years of experience and then my years of experience, it's just a great, phenomenal, just a mixture of both, and we work really well together. The only other thing I can tell you is that I think what sets us aside from the others is that we really listen to the patients about their wants, their needs, and we try to provide that for them. And we also we try to be very personal with the patient.
Yeah, that's very important. Now, turning to Chelsey Hartenstein, we're going to talk to you about, you're a licensed massage therapist.
Yes, I am.
So how do you fit into the Face2Face family?
Well, it really helps in your overall wellness and health and well-being, and we just want to make people feel good and keep their wellness up and help them out.
Yeah, it's important. I would imagine massage therapy would be very important for somebody who needs to relax if they're going to be undergoing a surgery that might put pressure on them or might make them feel a little nervous. So
Yes.
how do you deal with a patient who maybe does feel like that, and what do you do to calm them down?
Well, it really takes, you got to take the time to talk to them, find out what it is that they're looking for, what they're anxious about. And Dr. Madonna does really good about spending that time with the patient as well. But then it comes to me, and I've been licensed in lymphatic drainage as well that helps with pre and post-op surgery patients also.
Wow, so you've got a lot of things that you have to tune yourself into the client's real needs.
Right, and it all starts when I call the patient back to the room. I like to make sure and watch how they walk, how they move, their posture. The body never lies. And then once you get them into the massage room, that's when I have the face-to-face conversation with them, find out what it is that they're looking for and wanting out of the massage. I spend a little time asking them about their lifestyle, their activities, any kind of sports they play, or any medical pertinent, information. All of that goes in together in how I tailor the massage to best fit their needs for that day.
Why are your services so important to them if they're coming to face for, say, something else?
Well, it really helps boost the overall physical wellness and mental wellness of the patient.
Yeah, so what's your goal with each client that comes to you, and what do you want to do for them?
My number one goal is to make sure they leave feeling better than when they walk through the door.
That's a great goal to have. And I've always wondered, massage, some people consider it a luxury, but why do you think massage is really important, maybe not such a luxury, but something that's needed in people's lives?
Well, the benefit of massage, there's so many benefits, but the thing that I like most about it is it's easily incorporated into everybody's lifestyle, young, old, babies, surgery patients. It really is just an all-natural treatment that you can benefit so greatly from.
What are some of the other benefits? Because many people think of pain relief when they think of massage and massage therapy, but what are some of the other things that you can benefit from when you get a massage?
Well, there's physical benefits and mental benefits of massage. Some of the physical benefits, it relaxes the body, it can help lower blood pressure, improve your skin tone, reduce swelling, like I said, with the post-op, pre-op surgery, and then it can help improve your posture. And then on the mental side of it, helps reduce anxiety and mental stress. It can help promote quality sleep and can improve concentration.
Oh, see, those are excellent benefits, and those are good things for people to know who are interested in getting massage as to why they would want to have the massage and what the benefits are going to be if they do go through and have that, which we would encourage them to do for those reasons. Now, here's a question directed at both of you, Tammie and Chelsey. What are the overall benefits of coming to you at Face2Face?
Professional, experienced, personal. We provide quality services and treatments.
Yeah, it's not so much a sale, but it's a specialized service that you're going to be getting.
It's a face-to-face consultation with the patient to find out their wants and needs and to make sure that we can provide that for them.
Yeah, and also to you, Chelsey, what about those benefits, those overall benefits of seeing you?
Well, I mean, it really goes down to, first of all, I love what I do, and that makes a big difference. I have that passion, and then, we do take the time to listen to the patient and find out what it is that they're really wanting. And sometimes you get out of, I know like Dr. Madonna said, they come in for one thing, and then you sit and talk to them about their realistic goals and their expectations and how you can help, and sometimes help them out in ways that they didn't even realize they needed.
Yeah. That's right. Well, thank you both for coming in. There's one more question I had for you, Chelsey, because I just asked Tammie about that. What about working with Dr. Madonna? What's the benefit there for you?
I really think that he is genuine. He really cares about his patients. He really cares about the work that he does. And it means a lot to know that someone is there to really listen to your needs and give you that treatment that you deserve. Yeah.
And where, again, can we find more about the services and the number we can call?
855-MY-1-FACE.
And face2facefl.com. So thank you both, ladies, for coming in.
And thank you for having us.
Yeah, we really appreciated that.
It's been great.
Yeah, thank you. And we'll see you again soon. Thursday, April 2nd, our next show that we're going to have on Focus Television and Radio is going to be with Dr. Wassel of Tri-County Podiatry. And you can watch the March episode now of Hometown Health TV featuring both Face2Face and Dr. Daniel Wassel of Tri-County Podiatry and find out what all of these great practices are doing to help their patients. Don't forget to look at our March Madness issue of Focus magazine, which is on stands now in more than 100 locations throughout Lake County. You can find out what makes your fellow Lake County residents mad and what we can do to calm down. Also, we are looking at areas, maybe some of the doctors, I know Dr. Madonna was in there, the Ultimate Operating Room playlist, the songs that the doctors and surgeons are listening to while they're working on you in surgery. Kind of an interesting thing. Dr. Madonna had his favorite song in there, so that's something you'll want to pick up and find out what him and other surgeons were thinking about. Plus, we have a fictionalized serial story called Six Hands about the character Michael Green and how he's trying to mend past relationships failures. And it's just a very interesting story. Mark Roberts, our owner and operator, our publisher of the magazine, he was the one who started that off, and we're going to have some other writers come in and finish that story for all us. All this and much, much more. New owners, new attitude, new opportunities, but the same focus. Next show, April 2nd, where we're going to be interviewing Dr. Daniel Wassel with Tri-County Podiatry, and I'll talk to you then. I'm Anthony Rayo, and thanks for listening to Focus Radio.